the choice of what to use first for our patients with metastatic melanoma in the first line setting is complex, again, because we have effective immunotherapy, we have effective targeted therapy, and we've never had them compared head to head. However, there's a strong preclinical and clinical data indicating that the combination of targeted therapy with immunotherapy can be highly effective. In fact, targeted therapy, again, can modulate the tumor microenvironment to make it more responsive to immunotherapy. And so there has been several triplet trials that add a PD-1 antibody to a BRAF and a MEK inhibitor combination. Most of them have been phase 1, phase 2 trials, most notably a randomized phase 2 trial called Keynote-22 that randomized 120 patients, 60 on each arm, with pembrolizumab, dabrafenib, and trametinib versus dabrafenib and trametinib alone. The interesting results from most of these early phase trials is that it's a combination that has a higher rate of toxicity, but that the toxicities are generally manageable with dose reductions and dose interruptions. So those combinations seem to have a high response rate, and so they've actually already moved into phase 3 testing. So there are 2 clinical trials that have actually completed accrual already. One is called Trilogy, that actually combines vemurafenib, cobimetinib with the anti-PD-L1 antibody atezolizumab. And that's also, again, randomized patients to that triplet versus the targeted therapy alone. And there's Combi-I, which is a combination of dabrafenib, trametinib, and spartalizumab, which is an anti-PD-1 antibody, and compares, again, that triplet to targeted therapy alone. Both of those studies have fully accrued and at this point are in the follow-up phase to try to determine whether this triplet approach is going to be more effective than the targeted therapy alone. I can tell you that at this ASCO meeting, Combi-I has actually reported some more biomarker data from a couple of parts of the study that were kind of biomarker driven. And then actually some safety and efficacy data from those patients that were enrolled on part 1 and part 2, which were kind of almost like a phase 1 and a biomarker study that were part of Combi-I. And both of these posters actually show some really interesting results. They show, again, the same thing, that this is a triplet that could be manageable. The toxicity is manageable, although definitely a higher rate of toxicity than targeted therapy alone. And then that the efficacy looks promising.